some new evidence suggests that intermittent fasting could provide many health benefits beyond weight loss. That's according to an article in the New England Journal of Medicine. Here to break it all down for us, NBC medical contributor, Dr. Natalie Azar. Full disclosure, I did this for about 4 or 5 days.
How'd it go?
Carson sucked me into it. It's not for me, but I think it's partly because of the schedule. But I was surprised to hear that it's beyond weight loss.
Yeah. So this was actually a review of past animal and human studies for multiple years. And what the authors posit as potential benefits, in addition to weight loss, is improving obesity, improving insulin resistance, cholesterol, hypertension, inflammation, also some cognitive parameters, all things that could theoretically improve longevity. How does this work, they say? Well, it's all about this thing called the metabolic switch. So what happens when you fast is that your body burns through all the sugar in the liver. Ultimately, then it has to transition into burning fat for fuel. That actually starts this whole signaling cascade in the body that helps to suppress inflammation. It starts to repair damaged cells and has all these benefits on a cellular level that could contribute to all of these potential health benefits.
Your body also becomes grumpy sometimes as well.
Yes. Good point, Kristen. They do say that it can take a couple of weeks, even months, to sort of, equilibrate when you do something like this. But I should mention that there are, I wouldn't say concerns, but some things to sort of point out for people who are considering doing this, especially in the new year. There aren't really any long-term studies yet on the potential health benefits. We're talking long-term. A lot of the studies that were done on overweight, young and middle-aged adults, so unclear if it's generalizable to everyone. And I think it is important to note that children shouldn't do this. Elderly people should not necessarily do this. People who are underweight or have eating disorders, pregnant, breastfeeding women. So there's, if you're going to do something like this, definitely do it with the guidance of a doctor and a nutritionist.
To Craig's point, though, isn't it tough to do this diet if you have a schedule that is complicated?
Well, that's the thing. So there's two main ones that I think are the most popular. One is the 16 and the 8, and one is the 5 and the 2. So the 16 and the 8 is basically that you're fasting for 16 hours and you have an 8-hour window where you're doing your eating. And by the way, you should be eating healthfully.
You can't just go out and go.
Yeah, fast food for 8 hours and then and the other one is the 5 and 2, where you're basically eating normally for 5 days, and then on 2 non-consecutive days you're restricting your calories. So people who are working night shifts or who have may not get to that 10 to 12 hour point where that mechanism, that metabolic change starts to really kick in. You need to have that prolonged period of fasting in there.